Hello everyone, my name is Liu Letong and I'm working in the Department of Endocrinology in Shengjing Hospital of China Medical University. I'm very glad to stand here to have lessons of diagnostics with you. Today we are going to talk about the physical examination of neck. I hope you will enjoy it. The lesson today consists of 4 parts: the lymph nodes, trachea, thyroid gland, and the cervical vessels. They are all the main organs on the neck. The first part, the lymph nodes. The lymph node is a part of the lymphatic system and participates in the immune response of the body. The lymph nodes distributed throughout the body, and the general physical examination can only check the superficial lymph nodes. We should know how to palpate the lymph nodes. Using the pads of your index finger and middle fingers, move the skin over the underlying tissues in each area. Remember, use the pads of your fingers, not the tip of your fingers. The patients should be relaxed with neck flexed slightly forward and, if needed, slightly towards the side being examined. You can examine both sides together or one by one. There are several groups of lymph nodes on the neck. When you examine the cervical lymph nodes, you should do it in the following order: preauricular, posterior auricular, occipital, tonsillar, submandibular, submental, superficial cervical, and posterior cervical, deep cervical chin, and supraclavicular. We should know where to palpate such groups of lymph nodes. We find the preauricular in front of the ear and the posterior auricular behind the ear. And occipital is at the base of the skull posteriorly, and tonsillar is found at the angle of the mandible. Submandibular is in the middle of the angle and the tip of the mandible, and submental is behind the tip of the mandible. Next, we examine the superficial cervical, which is also called anterior cervical lymph nodes. First, we should find the sternocleidomastoid muscle. If you can't find it, you tell the patient to move the head to one side, then you will see the muscle here. And we can palpate the superficial cervical lymph nodes on the internal side of the muscle and the posterior cervical lymph nodes on the external side of the muscle. And it's hard to find the deep cervical chin because it's deep in the muscle. The last one, supraclavicular. First, we should find the bone, the clavicle, and we palpate the supraclavicular lymph nodes above the bone. Okay, let's review together about the order. When we examine the lymph nodes, we, according to the order of preauricular, posterior auricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, deep cervical chin, and supraclavicular. Do you remember that? Okay, next part, the trachea. The trachea is normally in the middle of the neck, just above the supraesternal notch. When we palpate the trachea, we can put the index finger and ring finger on the protrusion of the sternoclavicular joint. Then we use the middle finger to palpate the trachea. If the distance from middle finger to the index finger and ring fingers are same, means that the trachea is at the middle line of the neck. Some disease called the deviation of the trachea. If the larynx makes the cavity of the affected side enlarged, it will push the trachea to the opposite side. Such diseases include a large amount of fluid, air in pleural space, and medial sternal tumor, unilateral thyroid enlargement and aortic aneurysm. If the larynx of the cavity make the affected side smaller, it will pull the trachea to the affected side. Such diseases include atelectasis, fibrosis within the lungs, and pleural adhesion. The third part is the most important part in the physical examination of neck, the thyroid gland. The thyroid gland envelopes the upper trachea and consists of two lobes connected by an isthmus. It is the largest endocrine gland on the body. As seen from the front, the thyroid gland is butterfly-shaped. An isthmus and the two lobes looks like a butterfly, and it wraps around the anterior and lateral portions of the larynx and the trachea. We can use the inspection, palpation, and auscultation to examine the thyroid gland to find if the thyroid gland enlarged. So there is a question here: how many degrees of enlarged thyroid gland? The answer is 3. The first degree, it can be palpated but cannot be seen. Second degree, it can be seen but within the lateral margin of sternocleidomastoid muscle. Third degree, it's beyond the sternocleidomastoid muscle. So if the patient has third degree, it means that the thyroid gland is very large. The enlargement of thyroid gland can be divided to the diffuse enlargement and nodular enlargement. Diffuse enlargement is usually seen in goiter and Graves' disease, which is one cause of hyperthyroidism. And nodular enlargement includes single nodule and multiple nodules. There are two approaches to palpating the thyroid gland: anterior approach and posterior approach. We can choose one approach to examine the thyroid gland. For example, anterior approach. The examiner and the patient should stand face to face. First, we find the isthmus. We palpate the isthmus above the trachea when the patient is asked to swallow, and we will feel a very soft tissues under our thumb. Then the examiner uses the left thumb to push the trachea to the other side, the opposite side slightly, and tell the patient to swallow, and the left lobe of the thyroid gland is palpated under the examiner's right thumb. Do it to the other side, use the same way. It's the anterior approach. Posterior approach means that the examiner should stand behind the patient. First, we also palpate the isthmus first. After that, the examiner uses the left hand's fingers, push the trachea to the opposite side slightly, then tell the patient to swallow, and the right lobe of the thyroid gland is palpated under the examiner's right hand fingers. Do it to the other side to examine the other lobe. It's the posterior approach. Have you learned that? If you don't understand it thoroughly, don't worry about that. I will show you on the practice course. The last part is about cervical vessels. We palpate the carotid arteries at a position about 2 centimeters away from the trachea on the internal side of the sternocleidomastoid muscle. Remember, you can't palpate both sides together. If you do that, it's very dangerous. Forceful position of carotid artery is usually seen in aortic regurgitation, hypertension, hypothyroidism, and severe anemia. When normal people is in a sitting or upright position, no jugular vein dilation can be seen. If you can see it clearly, means that the patient have high central venous pressure. So high CVP is usually seen in right heart failure, pericardial effusion, constriction pericarditis, obstruction of the superior vena cava, and high pressure of thorax and peritoneal cavity. Okay, it's all the knowledge of the physical examination of neck. You can review it by yourselves after the class. Thank you for your listening.